Is it working? Yes, I think it is. Hi, it's me. I thought I'd do a quick update. And you know when I say a quick update, that usually means it's going to be about 20 minutes of me rambling about crap. So, really, do I need it right in my freaking face? Yeah. So I got BirchBox. I didn't get Ipsy. I don't know why, but I didn't get Ipsy, so I'm not going to bore you with two really boring things today, just with BirchBox and all my update. Let's see my hair. Is it looking on point? I haven't put on makeup, so yeah, I've got bags under my eyes. Where's my makeup baggy thing remover? And that's Wonderlash. What's this? Is this makeup bag remover? It is now! Oh look! Got rid of my bags. Gone! Gone in 6 seconds. I'm gonna put it with the rest of my makeup stuff. Oh, look at that! I've got makeup stuff. I've got this thing that I was gonna give Holly for her brush, pencils. And I thought, oh, I'm gonna use it for my makeup brushes. That'll take too much room though. Alright, so here's my update. I had surgery on Friday, the 29th of July. I can't really see the camera. I'm having my eyes done at the end of this month with laser because the, what's the word I'm looking for? The lens transplant did not take. Or something. I can still see it flashing, and Holly really hates it when it flashes in my eye. So that didn't take. I'm wearing compression in the form of sweet sweat. I have got my 3 compression garments over there, but I'm still too sore on my hips from the liposuction. He reckons he took 600 cc's out of my tummy and my hips. I don't know from where, because it still looks the same to me. But he says I'm swollen. I love Dr. Felady. He is amazing. I know at the beginning I was a little, I don't know, disappointed because of the seroma I got on my hip, and my hips didn't look the way that I expected them to look. I wanted them to look more flat, and because of the seroma they didn't, and because of the incision it seems like anytime I gain any amount of weight it it's like somebody's put a rubber band around me and it sort of stops at the top of the incision, and then it looks weird because my hips look small and then there's this bulge, so it's really weird. So anyway, I'm trying to lose the weight and I'm doing well to get there. I mean, I've lost a few pounds, but I haven't worked out for a week. I started working out with weights yesterday. Not on that side. So here's what happened. Went in on that Friday and I said to Dr. Felady, my left boob crease is just not there. I mean, it's not just when I'm stretching my arms up, it's when my arms are down, there's no crease still. And on the right one, he did such a great job of putting in a crease after the dastardly maneuver of my breast being in my armpit, the expander breast thingy, tissue expander being in my armpit. I mean, I've got to say, and I never thought I would, but I actually love this size now. He said he's put in 600 cc's or something, which is like 300 each, although this one was smaller, so he should probably have put more in this one, but I don't know. We'll see what happens when it settles, because it's higher because of what he did. But I was looking yesterday or something, and I was thinking, I really actually like this size. I mean, I used to have boobs that protruded out of my sides, like, and out the front, but out the sides it made my body look wider because they protruded out the sides, and whenever I wore anything, I don't know if you can tell, but it's almost like flat now, and I kind of like that. I don't like looking like a big girl when I'm actually not that big. And so I'm really excited. He said that 50% of the fat grafting doesn't take, so it dies off and disappears. So I'm fine with that, actually. I don't mind. They don't look that much bigger, really, probably because it's been all over rather than in a certain area. So when I went in on that Friday, we waited. My surgery was supposed to start at 12:15, but we waited till just before 1. Everybody recognised me, surprisingly, because I've been there 3 times now, but I think it's because of my hair and also because I'm English. But because of my hair, because Holly always braids it, and and there aren't that many people probably that go in there with hair as long as mine. So I have really, really long braids. They had to put 2 hats on me, or 3. So yeah, so Holly always does that. It's like a tradition when I go for surgery, is that she braids it. So I said to him, look, there's no crease on the left breast, and it just looks like if it ever does form a crease, it'll be really low. And it had only been just under 3 months since my last surgery, so at some point I'm thinking maybe it will form a crease, and it would make it very low. And so he said, you know, I think yes, we should redo it. Redo the pocket and the crease and stuff. And so I said, okay. And then he said, with the fat grafting and everything, it probably wasn't the best idea to do the nipples. Plus, the insurance had not approved the nipple reconstruction, which they should for breast cancer reconstruction, bilateral mastectomy reconstruction, because it's the law. So they hadn't approved it because they don't apparently like to approve more than 1 procedure or 2 procedures, and they had to do lipo, fat grafting, nipple reconstruction. So in the end, what he ended up doing was the left pocket he had to redo. So he had to take the implant out, redo the pocket, do a whole bunch of more stitching underneath, and then he did put the implant in and so I've got the whole incision is open again. Well, it's not open now. I mean, I'm not like dropping implants out and stuff. And then he also redid the entire tummy tuck scar, which I thought was brilliant because I thought he was going to do that in his office while I was awake. He did that, and he did liposuction, and he did fat grafting, and then he put, because I'm so allergic to the tapes, he put glue over the stitching. I've still got on my, I can't lift this up, maybe I can. On my arm, I don't know if you can see it, I've still got like redness on it from being allergic to the tape that they use, and it was only on for a few hours because I left that day, didn't have to stay over. I felt really sick, so I had to take lots of anti-nausea stuff, but I didn't throw up, although I did come close. I was dry heaving for a while when we got home. So that was good, and I was sore for the first 2 days, like really sore, and then it got better. And I mean, I'm sore-ish, and it's itching on the incision from the tummy tuck. My breast is fine because I have no sensation in the area, like the main part. It's going to take a while to settle, and then eventually I'll get the nipples done in office, and then we'll see the tattoo person for the areola, and that'll be that hopefully. So that's that, and then this month I get to get my eyes done. Isn't that fun? Oh. As far as Oliver's concerned, everything's fine with him. It turned out to not be anything bad. I'm not sure if I mentioned this last time, but anyway, that's the way it was. And I started weights yesterday. I'm going to do treadmilling today, and I just feel like, I'm having pain in my left side, which is costochondritis, which a lot of women get after breast bilateral. My hips still hurt from the bruising, but yeah, some women get. A lot of women actually get it from bilateral mastectomy reconstruction. So weights was actually helping that before I went in for surgery, and so that's why I really started yesterday, because I was getting a lot of problems, and when it hurts, take a deep breath, you have to restart doing stuff. So that's that. Today, BirchBox, yay! Okay, let's see what I'm going to embarrass myself with today. This time I might actually read the instructions. How about that? When I get 2, do they know me that I have to get 2? Oh, I love that! Pore dermabrasion by Dr. Brand. I liked that before. Which one's that? They sent me another one? Oh, how sweet! I loved it before. And I've been very frugal with it, so I've still got some left. Yay! This is pore dermabrasion from Dr. Brandt. A boost of salictic? Yes, I pronounced it correctly. Acid unblocks pores, caviar lime brightens, and lentil seed strengthens and tightens pore walls. Can you see my eyeballs, like the lens is like flickering? No? Okay, that's that. Then we have, there's a big bottle of something. R Plus Co Death Valley Dry Shampoo. Look, don't get dry shampoo. I know a lot of like gurus on YouTube love dry shampoo, but I have very long hair. You know I have very long hair. Let me show you how long my hair is. Well, I don't want to get up too far because I'm not wearing bottom halves. Anyway, it is very long, okay? It's very long. If I can be asked to wash my hair, why can't people with short hair be asked to wash their hair? That's my question, really. I mean, I don't wash it that often. I wash it every like 3 days. But it gets used to it and it doesn't get slimy and greasy. So I don't understand the need for dry shampoo. I just don't. I mean, maybe if you're washing it every day and you skip a day and it gets greasy, maybe. Stop touching your freaking hair. I mean, I use conditioner and stuff and it still doesn't make my hair greasy and slimy unless I leave it a week, which I'm not going to, even through surgeries. I don't do it. So anyway, R Plus code, Death Valley, dry shampoo, blah, blah, blah. Full-size bottle is $24. Oh, the Dr. Brand thing was, the full-size thingy is $58. Glad they sent me samples. Okay, Marcel somebody or other. Which one's the Marcel one? Well, they put it in here, but they didn't send it. Oh, they did send it after all. Okay, this is BB Cream Golden Glow. Full-size bottle is $28. What is this for? This multitasking BB cream gives your skin a golden glow while controlling shine and masking imperfections. Should we try it? I haven't done a I haven't washed my face. Okay, let's be real. I haven't washed my face. What the frick is this? It's got colour on it, like my nails. What am I supposed to do with this? I mean, really, makeup guru that I am. What is it for? A moisturizer, but why's the moisturizer got colour on it? Minimises the look of wrinkles. Maybe I should put it on my butt. Okay. Oh, shut up. Where should I put it? There? Oh, I mean, I don't know. Oh look, it covered my bags. It's not even my colour. Oh, it smells like butthole. Baby butthole. Shh. I can't use this, it smells so bad. Give me a tissue. Take this shit off, it stinks. Anyway, I'm sure somebody would love it. Somebody ate me. Okay, is there something that smells good in here? Next one. God, this stuff stinks. I don't have anything to wash my hands with. Vitamin C serum. That's gotta smell better than my freaking hand right now. Okay, that doesn't smell better either. My antibiotics will smell better. Ah. Okay. MD Solar. Is that the one I just used? I don't know. I'm so bad at this. Okay. Daily anti-aging moisturizer. SPF 30. Full size. Oh, the other thing was the Marcel one. The smelly shit was Golden Glow was $28 for a full size. This is Daily Anti-Aging Moisturizer by MD Solar. This multitasking derma-proof moisturizer, another moisture. Oh wait. I think I got the last one wrong. This is the one that minimises the look of wrinkles and has SPF, protects skin. Oops. Oh, it's got one of those little things on it. Ooh, this one doesn't have brown coloured stuff on it. Oh, this one smells good. And this one's a moisturiser. Oh, I might be able to use this one because this one doesn't smell of butthole. Oh, my nails are so freaking, what's the word I'm looking for? Translucent? Oh, look at that. It's so moist. I should have probably washed my face. Okay, last but not least. Wait, I've already done that one. Oh, the dry shampoo. Yeah, that one's 17 to 29 dollars. full-size bottle. Style refreshing spray that absorbs excess oil, gives hair volume and body, and adds tussle texture. Well, since I straighten it, I don't want it to look tousled. But let me just smell it because I'm not going to use it. I just want to smell it. Smells good. It smells better than the butthole one. Okay, this one smells of butthole. The rest smell fine. And that is the only one I think I'm going to... Oh wait, there's another one. What's this? Beyond Mascara from Benefit Cosmetics. Oh, that was the top one. Full size is $24. Formula with all day wear for lashes so long and thick you may be accused of fakery. And a girl does not want to be accused of faking anything, does she? Right, let's see. Let's see if this works. I'll be right back. Oh, look at that. God, I'm faking it. What a big difference that didn't make. You know what? I still like the other one. I'm going to do the other eye anyway because, let's face it, it's going to look silly with just one eye done. Not that you really notice a difference, which is not a good advert for a mascara. And you know, this is from someone who rarely wears mascara at the moment. Can you see a difference? No. I haven't done the lower lashes, and guess what? I'm not going to. It's not bad, but you know, once you've gone L'Oreal, you don't go back. Alright, I was talking to my friend about vegetarianism, or what I was making for dinner tonight, and I'm making something with ground turkey, I think, or chicken or something. And then we were talking about, I was saying I don't want vegetables in it, and he said something, I can't remember, and then I said green lives matter, because you know what, vegetables are people too. Actually, they're not people, but they exist. I don't know, forget it. But anyway, that's why we don't eat vegetables, because we care. Right, that's it. This hasn't gone on for 2 hours, has it? No, it's under 20 minutes. Woohoo! Alright, thanks for watching. Thumbs up the video if you liked it. I haven't talked about breast cancer today because I'm talked out, but I'd like to do another video on breast cancer because I had it. Oh, I'm seeing my oncologist on Wednesday, so maybe I'll do one after that. So anyway, thanks for watching. Thumbs up the video, comments below or on Facebook, and I'll see you next time, and subscribe and stuff, and you know, whatever. And talk to you next time. Bye.